Hey everyone, thank you for joining me for another episode of the Coach's Corner University podcast. My name is Paul O'Need, and today I am joined by Khaled Algashaamy. Khaled is the founder of Prime Life Wellness Institute. He's a board certified physician with advanced training in bioidentical hormone replacement therapy and metabolic disease. This is a new podcast for me. I don't think I've had a medical doctor on the podcast yet. You're also someone who I met within the strength world, and
Yes,
those two worlds tend to be at odds a lot. So I'm excited to
100%.
chat a lot about your new business venture, but also how it pertains to athletes like the ones that we tend to coach, and how you want to change the industry. So welcome.
Thank you, man. Thank you so much for having me. It's truly an honor to be here
It's
and
my
to be the first medical doctor.
yeah, it's pretty cool. So
It
you
is.
and I met through Mike Della Pava at Battle Axe
Yes.
Gym.
Yes.
You're a member there. I believe you were actively competing at the time.
Yeah.
Um,
Yeah. Yeah. I was one of Mike's 200 pounds strongmen.
and are you still competing?
No. So after we did Miami's baddest that I won in 2018, and then I competed in nationals. After that, I decided to take a step back because my residency training ramped up.
Oh yeah.
And then that was like I was towards the end of my residency training and then fellowship, so I really needed to take a step back. Also, qualifying to nationals kind of really solidified the idea in my head, like, okay, if I want to do this, I need to do it right. Also, I need to be on some cocktails that I wasn't willing to be on at the time.
Fair.
But yeah, I decided to take a step back, but it was awesome, man. It was fantastic. And I still do strength training, obviously,
Yeah.
and I kind of got into jiu-jitsu as well, so still very active, but just took a step away from competing. That's it.
How do you think, I mean, let's dive right into it. How do you think your athletic pursuits have influenced your practice?
Oh, immensely. Because one of the things about being an athlete is that you develop this grit and this perseverance. You now have transitioned your workout from, okay, this is just something that I'm walking in and I'm doing it, just going through the motions if I'm not feeling like it, etc., to, well, this is a job. Like, I'm showing up. Mike would had this program for me. We have these percentages that we have to hit. We have to have these reps that we have to hit. Everything is calculated. You cannot fuck up because that is your job,
Mm-hmm.
right? And then if you take that and put it into your professional life, you'll go far because you become pragmatic. You start understanding the benefit of like small wins. You start understanding the long game versus, oh, I missed this lift, it's the end of the world. You start understanding, like, no, like, I'm coming tomorrow. I'm
Yeah.
like, I'm living to fight another day. It puts a lot of perspective onto real life. And I feel like that separates it from, yes, if you go work out, you're going to develop some degree of discipline, some degree of, like, good attributes you're going to develop. But taking it to the next level of and competing, it just forges your personality into a different person and a
Yeah.
different level of professionalism.
I'm glad you said that, because I think I meet a lot of incredibly talented strength athletes that truly never achieve their potential off the platform.
Yeah.
I think it's probably a big limitation actually in their
Mhm.
ability, because they don't identify themselves with the attributes of being a strength athlete. They identify themselves with being a strength athlete.
I see what you're saying. Yeah.
So, for you to be able to say, hey, I learned so much of these things under the bar. Now I'm going to go and excel in medicine.
Right.
To me, that speaks to the true transformative nature that training can have on your life.
Oh, it's a great example for life. Like, one of the most common cliches that you hear, like a back squat really resembles life. The weight of life pushes you down, and your job is to just push it back up. And yes, the first time I heard it, I'm like, get the fuck out of here. But
Yeah.
the more you do it and the older you get, the more mature you get, you start realizing, like, no, this is real shit. Like, yes, this
Mhm.
does translate. Life will
Absolutely.
push you down, and are you going to get back up, or are you going to stay down?
Talk to me about your business, Prime Life Wellness. It's a
Yeah.
I know the name wasn't chosen by accident.
Right.
Talk to me about it.
Yeah. So My when I moved to the United States, so I did medical school overseas, and then I finished my internship. I did my internship in rural community services, and then I moved over to the United States. And when I first moved here to the United States, there was, the pursuit was that I wanted to be a surgeon, and that, I come from a family of surgeons, goes back 100 years. So like, this is what you're supposed to do.
Mhm.
And then when I came in and I started doing my rotations, there was a massive culture shock because it didn't feel like I was fixing anything. And I know a lot of people are going to hear that, especially if doctors are in your audience. They're like, "Oh yeah," and like, yes, that's the reality of things. But it just didn't really didn't settle in at the time because I was still young.
Mhm.
You don't understand the complexities of the machine that you're about to walk in. So it didn't kind of make sense that I would pursue this. I started talking to people like mid-career, and they'd be on like their second, third, fourth marriages, don't have solid relationships, don't really feel very fulfilled in what they're doing outside of the income that's coming in, you
Mhm.
know? And that could, obviously, I'm making a general statement that there's obviously some very passionate surgeons. That just happened to be the people that I interacted with. And I just could not see myself doing that. Also, I didn't see that we were really making any difference. We're just going at very fast pace, just going through cases. You have these RVUs that the hospital judges you by. What are you going to do? How many surgeries did you do? Like, there's always this productivity concept that you're being judged by.
Mhm.
So you are a physician, but you're being judged in a excuse me, in an ecosystem of non-physicians that are managing the hospital like a corporation.
Mhm.
So that was a disappointment for me, and then I decided to take a step back and see what type of training that I want to do. And at the time, one of my friends got into pathology, anatomic and clinical pathology, and he just loved it because it felt to him like he was doing a service, helping make a diagnosis for a patient who's about to have his or her life changed.
Mhm.
But also, the pressure was not directly on them because pathologists usually operate behind the scenes. They're not front facing like surgeons and cardiologists, etc. So the pressure wasn't really on them. They were more of like back end. And I did a rotation and I loved it because it felt to me like I'm getting a very deep understanding of how the human body works. And that's one of the things that pathologists have, is like they have depth of knowledge.
Mhm.
They The common term that pathologists get is they're the doctor's doctor,
Okay.
because the doctors come to you to seek, like, okay, hey, what do you think about this? You
Mhm.
know, one of the nicknames I have at the hospital is the Oracle, like from Matrix. Yeah. So, so I got into that, and in the back of my head, I never gave up on what I did in my internship, which is serving people, being in a community where I had time to like sit down and talk to the patients and form relationships with them, etc. Parallel to that, my athletic life was also growing, and I got more involved into sports with Mikey at the Battle Axe, and I started developing this passion to just being a strength athlete. And to me, those seemed like they're two separate worlds. Like, okay, I'm going to be a pathologist, I'm going to be a diagnostic physician, and this is going to grow on the side, and then see what takes off and where I lean more.
Mhm.
And then that slowly started to merge as I got deeper and deeper into sports. People when they find out that I'm a doctor, they started approaching me with things. And in the beginning, it was things like, hey, I have this rash. What do you think this could be? I don't want to go to the doctor.
Hey, you want
Yeah,
to look at my foot?
right. Like, literally, I've had guys like send me dick pics like, hey, man, what do you think this is? you know? So
Nice.
after receiving one too many dick pic, um, the conversations then started to transition of like, I'm diabetic, I'm pre-diabetic. What do you think I should do? How does diabetes work? I'm about to do this cycle. What do you think of steroids? What are your thoughts on them? Started to get questions about nutrition and that sort of stuff. So the 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 knowledge that I was developing from medicine was being tested like in the trenches by really intelligent people, because meatheads are some of the smartest people that you would meet, because they understand the necessity of pushing the physiological limits of your body, and
Hmm.
they want to understand what is happening so they can keep pushing and so that things don't break.
Right.
And I started really learning a whole lot, because I would have the standard medical advice of like, this good, this bad, very black and white.
Right.
And I'd be like, no, man, like, that's not how it works. That's not how it is. This is what I have read. This is what I have learned. Hey, I saw this article, this and that. And that kind of helped in the evolution of my knowledge as a physician, because I'd have these interactions and then I'd go back into the medical literature and I'd dive deep.
Hmm.
I'd have an interaction and I'd go back into the literature and I'd dive deep. And it really filled up the knowledge base that I have to start then looking at medicine from an athlete's perspective.
Hmm.
So looking at, okay, how do I optimize my performance? How can I do better? Not just how I not get sick, because that's
Yes.
what modern medicine is. How do you not get sick?
Or
It's
even how do
developed.
you get over being sick when you're already sick?
Exactly, So it's developed after World War II. That's the modern medicine that we have. The main driver of it was World War II. You want to patch people up, throw them back into the assembly line, because you want them to be productive. And now we're in an age where it's no longer, oh, you have the flu, here's what you take. Oh, this is how you not get the flu. No, we're having people that are meta- metabolically ill, like Dr. Sean Baker, the carnivore MD. Like,
Hmm.
he has this stat that I've heard in one of his podcasts, and then I looked into it. The average American is pre-diabetic.
Yes. Yeah.
So we're having metabolic illnesses that are past the, hey, this is how to not get sick, and if you're sick, this is what you take. You're now trying to develop a deeper understanding of the metabolic condition, how to fix it, how to optimize it, and take it through those levels. We're now understanding the importance of dietary interventions. The common advice from the doctor is like, yeah, well, just eat good. But no one sits you down and tells you what eating good is.
Right.
Oh, well, you should exercise. But what is exercise? To what degree? Should you do cardio? Should you do strength training? If you're going to do strength training, what type of strength training? If you're going to do cardio, for how long? Should you
Hmm.
take hormones? Should you not take hormones? Like, you want to feel better, perform better, and then you just want to be healthy, right?
Hmm.
So all of those interactions started like coalescing, and that ended in me, like, finding a community there. It's WorldLink Medical, the Academy of Preventative and Innovative Medicine, through a gynecologic oncologist. We're still friends, her and I, to this day. She was like, "Look, if you want to get that understanding that you're looking for, this is the community that you should be part in." And I joined, started doing the certifications, and then just started to get deeper and deeper, and that led to me developing Prime Life Wellness. The goal of Prime Life is basically provide services as far as the treatment and the reversal of metabolic conditions, and that's really the goal. And the name Prime Life is to just allow you to live in that state of prime for as long as you possibly can. I'm very much against the term longevity medicine, anti-aging medicine, because those aren't biological facts. There is no such thing as anti-aging.
Hmm.
Aging is a biological, it's not a necessity. It's a biological destiny. Like, it will happen.
Right.
Like, the end point of a biological organism is to die.
Hmm.
You can not reverse it. You can extend it, yes, but you can't make any promises on that, because if you're coming to me and I'm promising you to live longer, you leave my practice and then you get a car accident and you're dead. That is me objectively breaking my medical promise to you.
Right.
So the goal is to allow you to live in a state of prime for as long as possible, for as long as we possibly can.
I
And
like
that's,
that.
that's the coalescing of all of that together.
I like that because for me, the idea of increasing lifespan never really sat well with me. It's like, I don't really care how long I live as long as the life I live is filled with life.
Right.
Right. So,
Exactly.
the
Yeah.
difference between lifespan and health span always, really resonated with me. And,
100%.
and, I'm coming to this conversation as somebody who has clearly made life choices that could potentially shorten my lifespan.
Right.
Right. Like, I've lifted weights that no one's lifted before. I've done things to be able to push my performance,
Of course.
but all of those decisions were conscious, right? In pursuit of a goal.
Right.
I would be lying if I said that I couldn't have made better choices.
Right.
But now that as I age, I'm 38 years old, I'll be 40 in a couple of
Mhm.
years. The
Mhm.
question then becomes, well, how do I keep doing this as long as I can? Like, how do I
Exactly.
keep living the life I want to live?
Right.
So, having someone like yourself who is very well trained in the areas that I'm interested in, you know, that strikes me as an incredible resource.
Thank you, man. Appreciate it.
So I'm very excited to see what you do, and I want to dive deeper into the things
Please.
that really light you up, because
Absolutely. Yeah.
I think more than anything right now, people have more information than ever, but I think
Absolutely.
they have less understanding. How do you, I mean, how do you square the circle of all the information that's available to people, and how do they make sense of it?
You don't.
Okay.
And here's my thought processing. So obviously, before we started recording, we brushed a little bit on coming to the United States. And
Hmm.
one of the advantages is that you have access to information.
Hmm.
Having a lot of information is never a bad thing. Access to information, fantastic. I love it. The whole thing, like misinformation, disinformation, this and that, like there's always a proportion. If you have more information, you're going to have more good, but obviously by statistics you're going to have more bad. That doesn't mean there is absolutely more bad. It just means relatively to the more good there is more bad. And your job then becomes to you dive deep into the literature, you develop a community of like-minded professionals who have experiences, and then you just ask, you investigate, you read, you educate yourself. That's really it. It's not I don't think that circle can be squared, and I hope my answer is making sense, because I'm not trying to limit that access. I want people to have more access,
Right.
but also I want them to be able to handle this information in the appropriate manner. And the way that I do it is that I'm always asking questions. I have a community of physicians that I rely on, some of whom have been doing this for 20 plus years. So it's not only the access to the literature, but it's also the access to the on the ground expertise. Because, for example, I'm pretty sure we're going to dive into this. I could tell you the benefits of testosterone, right? And I could list them all out for you,
Hmm.
and then the potential side effects, right?
Of
And I
course.
could tell you, this is the dose. This is a great dose. You're not going to get any side effects. It's amazing. You should do that. And then I take all of that literature information, and then I go to a patient, and then I give them that same dose, and they call me the next day, and he or she have a breakout with that dose. So, okay, that's a side effect, right? Then I'm going to need to deal with that. So, what do I do? Do I lower the dose? Do I keep it? Do I give them something else to counter that? So, having access not just to the literature, but having access to those people that have been doing this for 20 plus years to have these conversations with them is great. And then you read not just literature, there are a lot of really good books written on these topics by like investigative journalists, or bodybuilders, or
Hmm.
professional, any type of professional athlete, bodybuilder or otherwise. And then you can soak that knowledge from like the end client perspective, and then you try to come up in the middle with something that works for you, works with your philosophy of life, and then you apply that to your clients.
Yeah, I mean, the same goes for training and nutrition. I mean, I'm a big believer that there is no best solution or worst
100%.
solution. I think it's the trade-offs that you're willing to accept or not accept. And I
Correct.
think that goes with any medication, that goes with any
Absolutely.
any exercise you're going to perform, any food you're going to eat. At the end of the day, water will keep you alive, but you can also drown in it,
Exactly.
right? So,
Yeah.
um, I think with the advent of social media and people looking for the best this or the
Right.
most optimal that, I
It does
think
not exist.
I think nuance has been completely lost, man.
I totally agree. And I've had these conversations countless times with patients, with other doctors, with prospects, with some of my clients who are athletes. Sometimes I use the word patient and client interchangeably, so
Yeah, that's
forgive
fine.
me for that. But no, I agree with you. The nuance has been completely lost. And some of the things that I find interesting is sometimes a lot of that nuance is lost from the physician end. They
Okay.
perceive a lot of things as very black and white, and it's like this good, this bad, and then you know the it's never like that. It's always gray, and it's
Hmm.
always what does the client want, where do they want to go, and how can you get them there safely.
How much does the client's goal play into your role as a physician? And I'm gonna qualify my question a little bit
Please, please.
because I'll just draw a parallel. So
Sure.
as a coach, I get people who come to me and say, Paul, I want to lose 50 pounds in 3 months. Right? That's a
Mhm.
ridiculous goal, but I'll just use that.
Yeah,
And
sure.
I can say, cool, this is what will be required for you to lose 50 pounds in 90 days.
Hmm.
And I say, are you willing to do that? And
Right.
they say yes. I
Hmm.
say, okay, am I willing to coach you through that? Because also my ethics are at play as well.
Of course.
Because I
Absolutely.
understand the trade-offs involved.
Of course.
When you as a physician are working with a client,
Hmm.
are you trying to steer them towards the best possible decision for them in your eyes?
Hmm.
Or are you kind of letting them guide the ship?
It's a combination.
Okay.
So let me use an example. Like, let me use uh, I forget the word, but let me. So there's this really interesting book I went through, and one of the teachings in that book, it's a book about how to deal with individuals. And one of the teachings about that book is that when people approach you, you're part of their journey now,
Hmm.
right? And when they're approaching you as a professional, you don't want to be the hero in that journey.
Right.
You
Yep.
want to be the guide, right?
Hmm.
And your job right now is to guide them, right? Sometimes they're going to make good decisions, sometimes they're going to make bad decisions. Your job is to then give the constructive feedback for those decisions and why we got here. Okay? Once it comes, the only place where I draw the line is like when we're talking about basically, unethical issues or crossing the legal border. That's where I usually draw the line, because as a physician, a lot of people come to you because their perception of you is like you're an educated drug dealer, you know and
Right.
especially if you're working with a lot of like athletes. Sometimes the word goes around and they start approaching you with things because they think, oh, like he's a cool guy, right?
Mm.
Also, it's just the horror stories that I've heard about some of the clients that come to me with stuff that were prescribed to them by their providers.
Mm.
So the goal, I'm a huge believer in the sovereignty of the individual, and my job is to tell you everything about that decision, good and bad, so
Hmm.
that you can arrive at the decision that fits your moral hierarchy.
Right.
And if that moral hierarchy is way outside of mine, then I can't be your physician.
Right.
But if there is a little bit of overlap, it doesn't need to be exactly congruent. But if there is overlap, then yes, we can pursue the journey, and I'll continue to be your guide until a point where that moral hierarchy just totally separates. And that's the point where I can no longer be your guide. But you know what? God bless you, man. Continue your journey.
I'm really glad you said that. And I hope the coaches that are listening paid attention because that happens all the time in
Hmm.
coaching. There have been numerous occasions where I've had to stop myself and say, hey, this isn't a situation that I'm willing to be a part of. A great example I can point to, I had a client, we were working together. I made some recommendations on what I thought that that person should do.
Hmm.
Come to find out that they were doing way more and taking different things and
Yeah.
engaging in practices that I was not aligned with,
Right.
and realizing that I'm not a doctor for one, so I'm not prescribing anything. First and foremost, you give
Right.
options,
Yeah.
but the decisions that this person made were tied to my name because I am the
Exactly.
one coaching them.
Right.
And I knew that I could not have my name associated with such practices.
Right.
So their decision was made, hey, I can't work with you anymore.
Yeah. No,
And
I
the
totally
longer
agree.
you do it, the more situations you find yourself in. And I'm
Absolutely.
sure as a doctor, especially dealing with hormonal dysfunction, you're going to get into that situation quite a lot.
Yeah, and
Um,
it gets a little deeper, and I don't mean to interrupt,
no,
but it
no, go
does
ahead.
get a little deeper because for me, like I am the provider, right? I am
Right.
providing those medications, right?
Mm-hmm.
So then if it comes to the point where it's like, look, this is no longer just ethics and oh, I can't do this. Like, no, man, like these are now my responsibility because when you're administering something as a physician, that is your responsibility,
Right.
right? So the burden is heavier. It's no longer just an ethical burden, it's an ethical and a legal burden,
Yeah.
and it's a lot. But yeah, I totally agree with you.
So one of the things that you've mentioned a number of times in your discussion so far has been root cause.
Yeah.
So we talked about metabolic disorders, you talked about hormonal dysfunctions.
Mhm.
It seems to the root cause seems to be something that you're very interested in finding. Why is it important to know these root causes as opposed to just following the medical doctrine as it is and just treating symptoms?
It is super important because it can end up making you reflexive as a physician.
Okay.
I'll use an example from my practice, if I may.
Absolutely.
So oftentimes, you prescribe something to the patient starts taking it. Within a week or 10 days, they start noticing some changes and they usually reach out to you like, hey, I'm noticing this. What should I do? And then the unfortunate reality and the way that the current medical system is set up is that you, as a physician, are trained to always protect yourself legally. So the immediate thing that you do is like, hey, stop taking this. And then you go into your chart, you chart so and so reached out at this time. I told them to stop it. And, like now they know that they need to stop it and then just sign, right? If you're not understanding the root cause of what is going on, then to take it back to the guide analogy, then you're just taking them in this labyrinth and then you're not going to a destination.
Mm-hmm.
So the example that I want to use is I have a patient and we did all the testing that we need to do, all the history, examination, etc., and examination to the best that we can because my services are telehealth, but I
Mm-hmm.
still try to conduct an examination to the best of my ability. Um, and then based on all of these findings, I explained to the patient what my thoughts were, and then these are the things that I think we should do. Um, and we started. It so happened that the patient also had an unfortunate incident in their life, and that caused an extreme amount of stress. Now, the protocol that we had usually bumps up the heart rate by about 5 to 10 beats per minute, depending on the individual.
Okay.
And the patient was reaching out, complaining like, "Hey, my resting heart rate is usually around 65 to 70. My resting heart rate right now is 110. Okay, that's not good,
Nope.
you know." And I'm like, "Look,
Your rested heart rate is zone two
yeah,
cardio.
right." And then their impression was that it's the medication that they're taking. And I was telling them like, look, the medication does not do that. And the medication specifically, it's the desiccated thyroid extract,
Mm-hmm.
which has T1, T2, T3, and T4. And we can talk about that as the conversation goes. And I was like, look, it does not cause that. It can bump up your heart rate, but it does not cause that. I really don't think it is. I think it's this event that you went through, and it's the stress.
Hmm.
And the patient's like, no, it cannot be, because, when that event happened, my heart rate was fine, and I was fine for a couple of weeks after that. It started now. It coincided with the onset of taking the desiccated thyroid extract. So we arranged for a call, and then that's where the importance of being in constant communication with your patient and developing a relationship with them.
Mm.
My patients usually, like, as far as consultations go, we do about 6 to 8 hours throughout the year in a consultation form. But my patients talk to me almost every day.
Mm.
So we scheduled time, we jumped on a call, we started talking. All I wanted to do is just put their mind at ease that it's not the desiccated thyroid extract. And then fast forward 3 months, right? The patient is retired. So they went on a trip to Scotland,
Hmm.
where they were just in nature the whole time, hiking, just immersed in a very beautiful, amazing scenery.
Hmm.
Patient comes back. We had our consultation this last weekend, and the patient goes, oh, by the way, my heart rate was 65. Nothing changed in the protocol.
Right.
And I was like, I told you it was the stress. And then the patient was like, oh, I just didn't think it would be that bad,
Hmm.
because I've been stressed for so long and this and that. And I was like, look, we always underestimate how things impact us until we have to, like, see the impact in your face.
Right.
And then you had that opportunity to see. We made no changes in the protocol. The only thing that I just reassured to the patient is that, look, this is stress. And then the patient only believed it when they were in an environment that completely isolated them
Hmm.
from their stress, and then they experienced life as a normal human being. Now, I use that example to illustrate is that the importance of understanding the root cause of helped avoiding being reactive, immediately dropping medications that were delivering tangible benefit to the patient, and being a fucking doctor and sitting the patient down and talking to them. We had a call, like, our call was 45 minutes, through which we went through the causes that this could be the result of. And the logical thinking was that this could only be stress. And I knowing, having, obviously there has to be a degree of, like, being confident in your ability,
Right.
and the patient trusting you,
Mm.
because the
But
patient trust. Sorry, go ahead.
that's a conversation or like a treatment model that cannot be had in modern medicine.
Absolutely, 100%. Because the way that modern medicine works is that you call them, you are not even going to speak to the doctor. You're probably going to speak to the PA or the nurse practitioner or the front desk. And they're going to convey that message. That message is going to pass through 3 or 4 people if it makes it to the doctor, and maybe it won't. And then you're going to get the call back. Doctor says, stop taking the medication.
Mm.
And then the doctor turns back, charts it in his or her notes that, hey, patient called us with the side effect, and we told the patient to stop. If the patient continues to take, patient takes responsibility. That's so you alleviated the responsibility from yourself. But
Just passing the buck.
exactly. But being able to speak with the patient, having confidence in the capacity as a physician, patient trusting in your capacity as a physician, because that trust didn't come from you being on a pedestal and telling them what to do. That trust came from them seeing the effort that you're putting in addressing the issue that they came to you with.
Mm.
Where you tell them, like, look, I reached out to so and so, I spoke with so and so, I read this literature, here is this article. This is stress, right?
One
Sorry,
thing
go ahead.
that one thing that I see very often, especially when it comes to dysfunction or disease, is the identification with a diagnosis.
Right.
It strikes me as very interesting as you describe the model of care that you employ,
Mhm.
that if you would really avoid anyone doing that.
Oh yeah, you have to.
So what's your process? Because I have a back injury, or I
Mhm.
have chronic pain,
Mhm.
or I have type 2 diabetes. I'm not going to sit here and tell you that we can cure chronic pain,
Right.
but you are not the diagnosis of chronic pain.
Correct.
And if I challenge that,
Mhm.
that's no longer a challenge to the condition that you have. That's a challenge
Right.
to your identification.
Correct. Yeah.
How does that conversation go for you?
So there's two ways of going about this. First, if it's a diagnosis that I am making, we'll go with that. And the second, if it's a diagnosis that the patient has come to me with from like another provider, or this is something that the patient has been carrying their whole life, etc. So if it's a diagnosis that I am making, I do not start with the diagnosis. So the process goes that, we have this very extensive long form conversation of the patient just the question is literally, tell me why we're here. And then I just let them go on this 30-minute rant.
Mm.
And I don't even take notes. I have like an AI chat bot, and that bitch is just fucking cranking notes out for me.
Same.
Because my goal is just to be with them. Because if they're talking and they look, when they're talking, they're doing this, they're looking everywhere. And if they just pass towards the camera and they saw you doing this, gone. Like
Right.
you lost them.
Right.
Okay. So my eyes are here the whole time. It's like sometimes they're like, hey, are you frozen? you know?
Mm-hmm.
Um, so letting them just rant their way through the problem. And then we go through very extensive history taking with like very pointed questions, like a review of systems. We do a physical exam, like I said, to the best of our ability. And then I share the screen with them, and then I show them their blood work, and then we go biomarker by biomarker, and I tell them a story. And then at the end of all of that, now they have like a whole narrative. It's like a whole movie that we just went through, and now you're just finding out the name of the movie, and now you're just finding out the title, so that this whole time they've lived a story. This is no longer just, hey, you have this, and then they start asking the questions. Because if you just tell them, hey, you have this, and then they start asking the questions, now they're learning what this thing is and they're now identifying with it.
Right.
Versus if I walk them through this and then I tell them and I get them towards the end, and like the money shot is like, hey, by the way, these things, we call them this. And I
Mm-hmm.
don't say what you have is,
Right.
these things are called that. And this way, it's now you have a story, and I like storytelling is a very powerful thing. And when you frame it that way, it becomes very easy for them not to identify with this. Also, the immediate thing right after that is you're providing them with an exit strategy. Or if it's something that cannot be cured, like let's say a type 1 diabetic, right?
Right.
Then you provide them a mitigation strategy.
Mm-hmm.
You know, that's if I make the diagnosis. The second portion of this is that if they come with me carrying a diagnosis, then what I try to do is very small increments of, hey, what can you do today to meet me? I need you to be here. What can you do today to get closer to me? So let's dumb this bitch down. You
Mm-hmm.
know, I need you, for example, I'm trying to get their VO2 max to a specific level so that they become, cardiovascularly fit, and then have a specific way of life. Okay, you cannot do an assault bike 10 seconds on, 10 seconds off for 6 rounds. Bet, no problem. What can you do?
Right.
Can you walk fast for 30 seconds and walk slow for 30 seconds? And you do that like 5 times. If you can't do that, can you just go for a walk for 10 minutes? What
Mm-hmm.
can we do to get you engaged at a buy-in that you can provide.
It's
And
really
then you
interesting to me.
build on
It's sorry to interrupt, but it's really
that. No, no, no,
interesting to
fine.
me that you chose an example that didn't involve you giving someone medication.
Well, I mean, yeah.
No, 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 but that's good. Like to me, that speaks to the depth of knowledge because for me,
Mhm.
like I don't want to take medication.
Right.
If there's something that I can do for myself,
Mhm.
I'm definitely going to go to that first.
Absolutely. Yeah.
Medication for me is the last ditch effort. So if I
Right.
go to a doctor, and we see this a lot in Canada because of the overburdening of the medical system,
Right.
you go see your doctor and you say, "Hey, I'm having my blood pressure is a little elevated."
Mhm.
Okay, cool. You're going to take this medication. It's
Mhm.
not. It's not. Well, Paul, you're 250 pounds
Yeah.
and you aren't doing any cardio right now.
Mhm.
Let's try to do a little bit of zone 2 cardio every week and see if we can bring that down. Or let's try to increase your fiber intake. Or
Right.
let's do some blood work and look at your lipid panel.
Right.
Or let's look at your CRP or any of these questions.
Absolutely.
Luckily for me, I have the knowledge and the agency to know what kind of care I'm seeking. So I can
Right.
make those educated requests. But
Right.
I'm not your average patient.
Correct.
Um, it seems to
Just to
me.
carry sorry, just to
No,
carry
go
on
ahead.
something like that, and that's key because, uh, right now, HRT is a buzzword, right?
Yes, absolutely.
And a lot of people come with the predisposed notion like, hey man, like I literally get on these I do like a screening 30-minute call before I take
Mhm.
on a client. And literally in that call I'd be like, hey man, like, yeah, I heard that you're really good at prescribing testosterone. I'm like, what? Like, oh yeah, like I just need testosterone. I'm like, well, how do you know you need it?
Mhm.
Oh no. And they give you like this scripted answer, like, yeah, my libido's down and I don't have the mood to do anything. And it's a very scripted answer. And yes, hormones are very important. Hormones are very good for you. They're very healthy. But if you're taking testosterone and then you're leaving to go eat a cheeseburger, you're looking at this wrong.
Amen.
You know, it's a tripod of function, and those three legs are health, like nutrition, exercise, and then hormones. It doesn't start with hormones.
Let,
You need all those three.
let's go down that rabbit hole
Yes, please.
because I think hormone replacement therapy right now, my perception coming in from
Mhm.
Canada, hormone replacement therapy very hard to come by. The only reason I was able to be prescribed testosterone from my doctor is
Mhm.
because I told him that I had previously taken anabolic steroids. So
Right.
he prescribed me testosterone under the guise of I'm getting him off street drugs.
Correct. Yeah.
To me, the perception of the United States system is there's all these HRT clinics. I can just walk in, I'll get my prescription for testosterone, aromacin or arimidex, and
Yeah.
HCG, and I'm out the door.
Right. Which
You're
you're not
you're
wrong.
you're flying in the face of that right now. You're saying this is the wrong way to do it.
Oh, 100%. And trust, like, I've had this conversation many a times when I first went on this endeavor, Prime Life. I had this conversation with potential investors. And when I laid down the business plan for them, and this is how I want to develop the relationship with the patients, and this is what, and it was very patient focused. Their next question would be like, yeah, but how do you scale this?
That was going to be one of my next questions, to be
And
honest.
my answer is that this is not scalable. For you to be a good doctor at a well rounded practice where you have relationships with your patients, you really cannot go past 300. And here's the kicker: you can make an amazing living out of this. Like, this could be a very, very, very good living. It's just not going to be scalable. And you have to be okay with that if you want to be a good doctor. Because what I tell what I tell people is that, look, You want to scale something, provide a different type of service, like maybe build a supplement company, maybe, I don't know, build an app, you know, do
So
something
yeah,
that
you
is
scale with adjunct services as
right.
opposed to the
Yeah, yeah,
actual medical practice.
exactly. There's exactly, I love that term, adjunct services. Or, like have a newsletter and build a following, have a podcast and scale that. Do something, but you cannot scale one-on-one patient interaction. You cannot scale a patient relationship.
I'm going to bet money you had a lot of trouble finding an investor.
I have no investors. This is 100% self-funded.
That's what I would have thought. And I mean, this isn't uh, that that's not a bad thing. I think it's actually a very
Not at
good thing.
all. Not at all.
But it's important for people to hear this. So primarily this is a coaching business podcast, right?
Right.
And ultimately you are sitting here across from me telling me that you want to operate a coaching business as a practitioner.
Pretty much, yeah.
Because what you're
Basically,
doing is you're coaching people on their health.
yeah. What I'm doing is I exited the insurance model,
Mm-hmm.
right? This is direct to consumer offering, right? I look at the lay of the land and I see a need, and I'm bringing my expertise to the table to provide that need. Excuse me. And what I want is individuals that are like-minded, that seek that help, that want to work with me, you know? And then I could totally scale by providing adjunct services. I could build a supplement, I can have a podcast, have an online following, have a newsletter, provide different services for people that you cannot immediately touch. And this is one of the things that I really have to, like, I struggled with this, right? So this is not just, it didn't just naturally come out the
Of
way that you're
course.
hearing it right now. Because every conversation that I had with every other doctor or every other potential investor, it was, well, how are you going to scale this? Right. And what's your exit?
Yeah, great.
And like, I don't want to scale it. I want 300 patients. I live in a state that has 25 million people. I'm asking for 300. Statistically, that's very possible. And then the next question, from if it was a doctor, they're like, oh, well, we want to expand this. So, like apply for licenses in every single state, get this, do that. I'm like, you're losing the point. You're losing the point. Like,
I mean, if you
come
had
on.
if you had a bunch of like-minded providers, right? Like if you were just the center cog in
Right.
a wheel of like-minded providers who are on board with your model,
Yeah.
you could scale the business as a whole,
Right. Yeah.
but that's a really long-term play.
Exactly. That's a very long term play. The
Mhm.
immediate term for you to have a successful business where you can make a living, provide for yourself and for your family, and serve people, you directly, I really don't see it more than 300. That becomes at capacity. And then after that, let's say, you take on a nurse practitioner, you have another like minded physician, and you develop like a business model where you can scale, like you said, the business as a whole. But again, this is very long term. And yeah, it makes it more. I like I said, very much struggle to get to that conclusion because I'm not, and I wasn't raised in that model of medicine. The model of medicine that I come from is scale, scale, scale. We did 10,000 cases this year, 12,000 next year, 14,000 the year after. You know, submit as much reimbursement to insurance as you can. Like more, more, more. Like we have the saying in pathology is eyes to scope. You have to maximize the number of hours your eyes are at the scope. That's where you're making money. Those are your billable services.
Mm-hmm.
If it's non-billable, don't bother me with it.
That's so nefarious.
Yeah,
It's
it's
almost
very
it's
frustrating.
almost predatory.
It is very frustrating. And don't get me wrong, like modern medicine brought on a lot of amazing things, right?
Right.
Very, very wonderful things that if it wasn't for modern Western medicine, we would not have. but it's just not built for that. And that's okay. You know, we are physicians at the end of the day. We can take on the responsibility, and then you can develop that skill and you can learn, and then you can do it.
How much pressure do you feel as someone relatively new to being a physician? I mean, you finished your residency, you did your advanced training.
Yeah, I've been
The
I've been in practice 3 years. So yeah, I'm a
re-
junior attending.
so okay, I'm assuming
Mhm.
that you accumulated a tremendous amount of debt while going through school, and I'm sure the pressure of repayment, like let's speak outside of you
Yeah, yeah, of
personally,
course.
right?
Yeah,
So
of
the
course.
average medical doctor goes through medical school, goes through residency, goes through advanced training, and
Mhm.
is now a practicing physician.
Yeah.
I'm sure a lot of the model of care of
Mhm.
churn
Yeah.
is geared towards I need to get as many billable hours as possible so that I can repay this debt and accumulate wealth.
Yeah. And it goes deeper than that. It's not just the billable hours. If you look at the healthcare system within the United States, medical students choose their residencies based on what pays the most, not based on what they like the most. And we did like research on this when I was a resident. We were giving out like, surveys, and we would ask, because I was in a residency program that is attached to a medical school. So we, as residents, taught medical students. And when we do these surveys, because you as a resident, you want to crank out research as much as you can so that you can build your CV, etc. And oftentimes, the choices that med students made as pertains to their residency is not what are they passionate about the most. There is a degree of like, well, do I? It's not do I love. It's like, do I hate it? And if I
Hmm.
hate it, then no, I'm not doing it. But if I'm okay with it and it pays well, man, let me do it. You know.
Yeah. I was speaking
So
with I was speaking with a friend of mine who luckily for him he loved it, but he's an anesthesiologist.
yeah,
And he's telling me about how he can charge X amount for X amount of time that someone is on. We were talking about epidurals.
yeah,
He's like, well, I can have four women going on epidurals at the same time, and I can bill them all the same amount per 15-minute interval, and blah blah blah. And I
yeah.
did the math really quick, and he's couple $1,000 an hour,
All right, yeah,
and he's doing that for 12 to 14-hour shifts.
right,
I'm like, oh,
yeah,
so this is what it's about.
yeah. You put them on the conveyor belt, move the meat.
Your model is what I would call a people over profit model.
Right. But
That's the
here's the
model. That's the
kicker.
model that we
Oh,
operate. Yeah.
but
Yeah.
here's
Go
the
ahead.
kicker. It becomes profitable. That's the interesting part. Is like you're starting with people over profit, but then you
Absolutely.
end up making profit, which is insane.
Dude, absolutely. That's
Yeah.
how we grew our business. We
Yeah.
focus exclusively on high touch relationship based business.
Right.
And because of that high touch relationship business, more business comes to us.
Right.
We end up hiring more coaches. Like, you talked about the cog in the wheel, right? So I'm that middle cog, myself, my wife, and myself. And now we have 5 spokes to the wheel. That
Right.
becomes 8 spokes, 10 spokes, 12 spokes,
Exactly.
people who are on the same page in the wavelength with us about service delivery,
Right.
and the business grows.
And the business grows. Yeah.
People over profit always works. Profit over
100%.
people very
100.
seldom works. I'm sure if you did the research on that, how many businesses fail when they try to scale for the sake of scaling?
Any when I decided to go onto this venture, I started reading a lot into business because I've
Mhm.
never run a business.
Right.
And I didn't want to sign up for an MBA and back my plan for like 2 years to get, I just wanted to just start. So I
Yeah.
started reading. And every business book that I read, they talk about marketing, they talk about this, but then they make it very clear like, hey, man, if your service is shit, aren't coming back.
Hmm.
Like, build your service, make your service so good, people feel stupid saying no. And that's the Alex Hermosi quote.
Right.
Like, make them an offer so good they feel stupid saying no. And how do you make them an offer so good? Is by jamming as much of a service as humanly possible. Then when you give them the price, they're like, holy shit, I get all of this just for that.
Hmm.
But if the equation comes, I get just this for all of that, then you're losing. And
Educate.
sorry, go
Go
ahead.
ahead. No, no,
No,
you
no,
go
no.
ahead.
No, and what I'm saying is like it starts slow,
Hmm.
but then it builds up quick,
Yeah.
and you just have to be patient.
So, I mean, this is more of a personal question than anything. I just ended up spending like $570 a month on health insurance.
Yeah,
Obviously, you're operating outside the health insurance model.
right.
What's stopping a person like me from canceling my health insurance and then just working with you?
So health insurance, this is one of the things that we were saying. Like modern medicine did bring a lot of really beneficial stuff,
Hmm.
and you have to leverage your health insurance for that. So I always tell people, because this is not, believe it or not, this is not the first time I got this question. Like, well, I could just cancel and then I'll just pay you.
Right.
And I'm like, listen, here's the thing. There will be a time where there was something that you will need your health insurance for. God forbid something happens of like a car accident.
I tear both my quads.
Yeah. Where you need like legitimate, very sophisticated medical intervention.
Hmm.
You know, an orthopedic surgery, a cancer surgery,
Hmm.
radiation, immunotherapy, chemotherapy. Those things are extremely expensive. They are the number one cause of bankruptcies in the United States of America.
I read that. That was a huge driver for us to like, hey, what's the
So,
best insurance we can get? Let's get it.
right. Yeah. So, what I tell people is like, look, you need to get it. You get it so that you can have it, so that when God forbid something happens, you can sleep better at night,
Right.
But if you're thinking that just because you're getting your health insurance, you're going to get that type of service, no, the fuck you're not. But get it, because when you need to drive to the emergency room during that drive, if you're looking at your bank account and you're like, fuck, 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 then you fucked up.
Yeah.
But if you're going to the emergency room, like, hey man, I need this. What up?
Yeah.
Then, like, yo, where's your insurance? This is your insurance. This is what you need. Because, yeah, you don't want to be driven to homelessness because of a fucking hospital bill.
Yeah. That was a big fear of ours immigrating here.
Yeah.
It's like, how do we
Yeah, especially
navigate
for you
this
guys from
system?
Canada. Yeah.
And I mean, Canada has its own issues, man. I mean,
Right.
when it came to my surgery, like we were in the hospital for 9 days as opposed to
Hmm.
4 because of
Wow.
the bureaucracy.
Right.
My quote unquote free physical therapy didn't call me for 12 weeks, even though luckily for us, I have the expertise, the means, and the connections to go get
Right.
care on my own.
Yeah.
I was able to do my own rehab. So that was,
Yeah.
huge.
Yeah.
Um, and even the hospital equipment that we had in the house, I had to
Hmm.
pay for it out of pocket because the free
Jesus.
stuff only supported 4 weeks and I needed it
Right.
for 8.
Yeah.
Right. So there's a lot of limitations with the Canadian system that people don't necessarily talk about.
Oh yeah,
And
absolutely. And this is great for, listeners who are American who are advocating for, Medicare for all.
oh, don't
You
do it.
know,
That's
yeah,
my advice. Don't
yeah.
do it.
No
Um,
country that has done it advocates for doing it. Look at NHS in the UK; it's falling
oh,
apart. Look at
yeah.
Canada. You know,
Let's switch gears towards metabolic disease.
please.
Uh, as a Canadian moving to the US,
Hmm.
forgive my generalization, but Americans are really fucking fat.
Oh yeah, they are. They're super fucking fat, dude. It's insane. It's insane. We're
Uh,
so fat, man. We're so
so
fat.
fat.
Yeah.
When you talk about, I'm a big believer that most conditions that we
Hmm.
run into, cancers,
Hmm.
cardiovascular disease, their root cause is metabolic.
Absolutely.
How do
And
you
well,
go about changing the narrative over medication from medication to lifestyle?
yeah. So just a little caveat on the whole cancer stuff, because some oncologist or another fellow pathologist will hear this and be like, "The fuck are you talking about? We have isolated driver mutations." Listen, the majority of cancer is metabolic in nature. The minority of cancer is driven by genetic mutations that are, what's the word? I'm blanking on a lot of words, so I'm sorry.
That's
But
okay.
the minority of cancer are genetic mutations. The majority are metabolic driven that lead to genetic alterations. And once you have the alteration, you have the cancer,
Right.
right? So when we say caused by a genetic mutation, I mean like you're born with this,
Hmm.
you have this, you know, like a BRCA mutation for breast cancer, for example. That's the best example. And there's others for all types of cancers. And then the rest, man, they're predominantly metabolically driven. There is a very awesome researcher. I am blanking on his name, but I can send it to you and then you can add it to like the episode notes or
Yeah, for
whatnot.
sure.
He is a cancer biologist out of Boston University. And he has been doing research basically showing and demonstrating that cancer in its essence is a metabolic disease that then gets genetic mutations that then drive the disease.
Right. Which
You
makes
know,
sense.
so
Yeah.
yeah, so like the metabolic issues are basically like what gets you to the highway, and then
Hmm.
once you're on the highway you get a mutation and then that takes off.
Right.
So yeah, I just wanted to add that caveat, but yeah, go ahead, sorry.
So a big driver for you with Prime Life is changing that narrative,
Yes.
is addressing those root causes.
Mhm.
And when you think about the change that you want to make, because we're nearing the end of the hour, and I want to really put a bow on this one.
Sure.
We are in a position, myself as a coach, because
Mhm.
I believe, as a coach, as part of the medical team,
Mhm.
I spend more time with people than doctors do. I spend more time than physical therapists do. I spend more time than even, mental health therapists do.
True.
I see my role as the guide, as you said.
Mhm.
But I personally need good information. I need a good GPS
Mhm.
to guide properly. And that's where I lean on medical providers. What do you see as the pinnacle of what Prime Life can be? Like, what is your ultimate pipe dream goal with your company?
Honestly, is to really be able to just serve the clients that I directly work with. If I'm able to change their minds, then I win. You know,
Dropping, so you're a pebble in a pond kind of guy. You're going to
not
drop your pebble in the pond and you're going to see those ripples extend to the edges.
for now,
Okay.
because Prime Life is 1 year old,
Right.
right? And my goal for now is to be able to change the minds of the individuals that I'm working with.
Mm-hmm.
And then as I grow, obviously the aspirations will grow. My my hope for my reach will grow as well. But the essence will always be, if I can educate the minds of those individuals that work with me, who then will go out and talk to other individuals and change their minds,
Mm-hmm.
who then go out and educate individuals and change their minds. As a starting point, I feel like then I would have accomplished my goal.
I love that. And that's honestly where I see it as well. That's where I see my business as well. So there's a lot of alignment there. The model of people over profit for me cannot be beaten. It's
I
also
agree.
it's the most fulfilling.
It
And
really is.
I'm very excited to see where you take this business
Thank you.
and how many people you can impact. I definitely think that a follow up podcast discussing some X's and O's would be really fun as well.
I
Going
would love
into
nothing more.
Yeah,
Truly.
because I think I deal with a lot of clients with thyroid dysfunction,
Right.
PCOS, things of that nature, and I think who better to talk about it than you, man?
Yeah,
So I'll definitely have you back on.
believe it or not, when I started this, I thought that I'll be working with a lot of men, and 90% of my patients are women who have PCOS and or are perimenopausal. And I still have men, but that's just not the majority. So no, I would love nothing more to have more conversations and provide as much education and resources as I possibly can.
Beautiful. Let's do a couple of quick hit questions before we finish
Please.
because I know at heart you're a bit of a meathead.
Sure.
What's your PR song?
My PR song. Oh man. there is a um, there's this Viking band that Mike used to play at the Battle Axe.
The
That was
drums.
the drums. That is my PR song. It's just it's a whole different vibe, man. And whether I'm in the axe or outside of the axe, that is my song. And believe it or not, now it's just PR period. Any win that song is playing, regardless whether I'm lifting weights or not.
I love that.
Yeah.
What's I mean, you're a doctor, so let's go into what's been the craziest non like craziest duration without sleeping that you've gone while working?
3 days.
No fucking way.
Yeah. 3 days. That was during my surgical internship overseas. It was 3 days of not being able to basically catch more than like just a shut eye and then get right back into it. And it was awful. It was horrible.
Oh my god, I was not expecting that.
It was horrible, man. It was horrible. And honestly, past day one, I really don't think I provided really good care past that. Everything was just downhill from there.
Yeah, I can
And
imagine.
I don't really understand why people still do it or push it, but I did it that one time and it wasn't even intentional. It just so happened like the stars aligned. But man, it was horrible. It was horrible.
The last question I have for you. If there
Please.
was one person that you would like to see me interview on the podcast, who would it be? But
Hmm.
the caveat is that
Mhm.
you have to help me get them on.
Okay. Well, great question. I think. Oh, can I give two instead of
Sure.
one? All
Yeah.
right. So in the through the academy, the training that I did, the founder of the academy, Dr. Neil Rousier, he's an emergency doc, and he founded this academy about 30 years ago. And man, the passion with which this man teaches and the depth of knowledge that he has and just the grasp of the literature that he has at the palm of his hands is insane. And then the second one would be the pharmacist that is on board in the academy, and her name is Christy Hales. And she is an immense resource of bioidentical hormone replacement therapy. I personally lean onto her because she can recite articles and citations like in the back of her head. So I would reach out to her like, "Hey, Christy, I have this patient and they're complaining of this and this and that, and I gave them this and this and that." I get the response with what is causing this or may not cause this, and whether the hormone is related to it or not. Along with it, the article that cites that. So those two are amazing, amazing, amazing resource, and I've learned so much from them.
Well, I'll definitely link that up with you
Yeah,
after the podcast.
yeah.
Um, I'll have links to wherever I can find you in the show notes, link to your website, and
Okay, thank you,
dude, I'm very excited to see this grow. And
thank you,
if I
Paul.
can be a resource for you in any way, you just let me know.
Thank you, man. I appreciate you. That really means a lot to me. Thank you so much. I have so
My,
much respect and admiration for what you do, so it really means a lot to me. Thank you so
thank
much.
you, everyone.
Thank you.
Please make sure to like, share, subscribe, ring the bell for notifications, and we'll catch you on the next one.